Well, diabetes is a serious disease that affects over 30 million Americans. Yet 1/3 of people don't even know they have it. Our next guest wants you to know the warning signs of diabetes and how it can be managed.
That's right. And here to give us some helpful advice is Dr. Michael Gonzalez. He is an endocrinologist.
Right.
Nice.
Try spelling that one.
Nice.
At Healthcare Partners Medical Group. Great having you, my friend.
Thank you. Thank you. Good morning.
So why is it important to explain to our viewers the warning signs of diabetes? Because I'm assuming there's a lot of people out there that might have diabetes,
Right.
and they just haven't been told.
Correct. So right now, the estimates are over 30 million Americans do have diabetes, and almost 1/3 of them do not know that they have it.
Wow.
And it's a growing epidemic. It is expected that by 2030, that amount will double. So we'll have over 60 million people with diabetes.
Wow.
And it places a huge burden on our healthcare system, primarily because it leads to complications. Diabetes is the leading cause of blindness, kidney failure, amputations. And the sad thing is diabetes can be preventable. There are two types of diabetes. Type 1 diabetes is characterized by complete insulin deficiency, and it's really an autoimmune disease. Unfortunately, it cannot be prevented, but it can be managed. But the more prevalent diabetes is type 2 diabetes.
And this is really a lifestyle
Correct.
onset. Yeah.
Correct. And the problem is that it occurs because of a complex interaction between genes and environmental factors.
Yeah.
If you're African American, Hispanic American, Native American, Pima Indian, you have a higher risk of developing diabetes, two to six
why?
times.
Yeah.
There are a lot of complex genes involved, unfortunately. But the thing is, even if you don't have that background, you can still develop diabetes because of the environment. And we're talking about the increasing problems with childhood obesity, not having an active lifestyle, being sedentary. So if you look at some Japanese Americans who were in California, migrated, their parents didn't have diabetes, but the subsequent generations have developed diabetes because of eating a lot of hamburgers, fast food, those kind of things.
They were raised in this environment.
Correct, correct. And that's also the problem in developing countries, where they're exposed to kind of first world food, and they're not eating as healthy as they used to. And again, their activity is decreasing, And so the signs and symptoms of diabetes can be summarized by 3 Ps. Polyuria, which means that you're drinking a lot of water. I'm sorry, urinating frequently, sorry.
Okay, gotcha.
Polydipsia.
You want to drink a lot of water. Am
Yes,
I right? You're
correct.
thirsty.
You're
all the time.
thirsty. Polydipsia, which is excessive thirst. And then polyphagia means you're eating a lot. Even though you're losing weight, you feel like you're always hungry and you're not getting enough energy. And with diabetes, especially with type 2 diabetes, you have it's a combination of the deficiency of insulin and insulin resistance. And so what happens with that is that your sugar stays high in the blood. And that leads to the damage to your body. It can damage your nerves, your blood vessels in the back of the eye, the blood vessels in your kidney. And as soon as the best way of managing diabetes is preventing it.
Yes.
So as early as now, try to stay active. You don't need to do something fancy.
You don't have to be running a marathon.
Correct.
Yeah.
Correct. So brisk walking, 30 minutes every day can help you a lot. You don't need to lose 100 pounds. What I tell my patients is that in studies, if you lose 7% of your weight, that's enough to help you prevent diabetes.
Wow.
I think that's really encouraging because a lot of people who maybe are overweight or have serious dietary challenges, they think it's like all or nothing.
Correct.
Like I've got to lose this whole, chunk of weight.
Correct.
And you're saying small adjustments can really help.
Correct. And what you want to do is take small incremental steps towards your health, because a lot of people kind of just bounce back. They overdo things, and then they kind of
They yo-yo.
Yes,
It's all or
they yo-yo.
nothing. Right.
And so what's better is to start with small lifestyle changes. And if you do develop diabetes, go to your physician. And if you need it, you can be seen by an endocrinologist like me. We are trained to help you manage your diabetes. So you still have to maintain a good lifestyle if you want to manage your diabetes. But there are many medications now that are available to you that can help cure, or not cure, but manage your sugars. Unfortunately, once diabetes is present, it cannot be cured. Certainly there is a lot more information today about the benefits of bariatric surgery. However, some of the effects are not long-lasting. So really, the best way to treat diabetes is to prevent it.
Absolutely. I was going to say, if you have a general care practitioner that is with Healthcare Partners,
Yes.
you're within the Healthcare Partners medical
Correct.
group, so you all share the same medical records. You're
Correct.
able to communicate directly.
Correct. And the beauty of having an organization like Healthcare Partners is that you will have an integrated system. So your primary care provider can send the information to us. And what's beautiful about that is you have early screening, early diagnosis, early treatment. And that's what we want. We want to help people as much as possible, as early as possible.
Catch it before it gets out of
Yeah.
hand.
Yes.
Well, it's great having you here, and welcome to our valley as well.
Thank you.
Yeah,
thank you
thank
very
you,
much.
Doctor.
It's great having you, buddy. For more information on Healthcare Partners Medical Group and a list of upcoming events they'll be hosting, you can just head to the website on your screen. They're also on Facebook and Twitter.